It's a joy for me to be here and an honor. First of all, I'd like to kind of clarify a couple of things. I'm speaking about some pretty serious topics: cancer, heart disease, global warming, and water scarcity. First of all, I'm not a medical doctor. I'm not a scientist. I kind of refer to myself as the big picture guy. I like to get things organized and figure out what's most important. Steve kind of alluded to that just now, talking about our book, which is basically trying to put as much information in a small package so people can understand it. So my background is a career business executive. I have a degree in engineering where we try to figure things out. We don't try to mess with the system until we understand the whole system in engineering. And in my case, I started out this journey in terms of how do I go from Ralph Lauren to talking about food and environment. In fact, somebody told me I should have entitled my first book From Polo to Plant Food. I would have sold a lot more books. But in my case, I guess I just got curious about what is the optimal diet for humans. That took place in 2002. I won't go into the background of why I got curious, but I did. And so I started studying it. And I got online and found a few books, and Amazon said people had bought this book, bought these 10 books, and so I bought those 10 books. And by 6 months later, I'd read about 30 or 40 books. We're talking about 2003 now. And during that time, I discovered T. Colin Campbell long before he wrote the China Study. And after 6 months of study, I'd concluded, okay, I'm pretty confident that the whole food, plant-based diet is the way to go. And then I read two more books over Memorial Day weekend in 2003. One by John Robbins, Diet for a New America, and one by Howard Lyman, Mad Cowboy. You may have heard of at least one of those books. I have since met both of those guys and most of the other people in this whole field. But that weekend, I realized, after reading all that they had to say about the environmental impact and social impact of what we're doing, the way we're eating, I had what I call my blinding flash of the obvious, and I said, oh my God, we're eating the wrong food. We humans are eating the wrong food. And that's when I started really accelerating my study. I decided to write a book along about 2004 because I wanted to pull everything together so people could easily understand this big picture that I was talking about. And then Colin Campbell came out with his book in January of 2005, and I said, how can I top that? I can't write a book after the China Study. But I did eventually write the book, Healthy Eating, Healthy World. It came out in 2011. So in my case, I like to get to the big picture. I like to simplify things so that 8th graders can understand it if they read it carefully. And in doing that, I think I try to get to a bigger audience than I ever could. So today, I'm going to change up the sequence here just a little bit, and I'm going to start with heart disease. I'm going to go to climate change. I'm going to go to water scarcity. And then I'm going to save cancer for last. And the reason is because I have recently started writing this book about cancer with a medical doctor in Ireland, and I've kind of done a lot of research, and I don't want to spend all my time up front talking about cancer and shortchange the other ones. So what do heart disease, climate change, water shortage, and cancer have in common? I call it MDEF, from 6 o'clock on the chart there. Meat, dairy, eggs, and fish. Meat, dairy, eggs, and fish have a lot to do with all of those problems happening, and the replacement of meat, dairy, egg, and fish with plant-based alternatives have a lot to do with solving all those problems. That's, in a nutshell, what they have in common. So in the next hour or so, I'm going to try to explain why I believe, again, I'm not a scientist or medical doctor, but I've done my own study, why I believe that eating mostly whole plants is the only way to reverse heart disease, the only way to stop climate change, the only way to solve the water crisis, and likely the only way to tame cancer, because there's not much science on that yet, but I believe that. And over the course of my study, the main thing that I eventually concluded was that our food choices in the 21st century are the most important topic in the history of humanity. And that's all about sustainability, and I'll talk a lot about that later, but I want to start up front by sharing this simple 4-point slide that to me says it all. We have 4 grossly unsustainable situations facing the world. 3 of them, overpopulation. We're adding over 200,000 people a day. Just during this conference, we'll add over 2 million people to the population of the world. Overconsumption. Now, this is a huge one. I'm talking about the way we live, the way we work, the way we travel, the way we play, everything that we do. We have a global economy that's based on the maximization of the consumption of stuff in a world of finite resources. A third grader can figure that out. That's just not going to work long term. Fossil fuel dependence, that's what gets all of the press. That's what people talk about all the time, is fossil fuel dependence. Well, the first 2, overpopulation and overconsumption of stuff, drive that. As we add more people eating higher on the food chain, more people driving cars, we depend more on fossil fuels. The problem with these 3 things is that they're not quick fixes. They're all above my job grade. I mean, think about overpopulation. I mean, most of it's happening in the third world, but it's still happening. Overconsumption of stuff. How do we change an economy so that we can all live here sustainably, indefinitely? And fossil fuel dependence. All of those first 3, I conclude, would take many decades, if not centuries, before the human species gets those under control so that people that follow us can live here sustainably forever. Here's where the hope comes in. And people sometimes think I'm doom and gloom, but I'm really not. I'm a half full glass kind of guy. And I always look for the good in things. And in this case, our food choices are the only thing on that list that we can change quickly. And it just happens to be the one change that can have the most impact on everything. It's such a win-win. It's a win for our health. It's a win for our planet. It's a win for our grandchildren. It's a win for those billions of animals and fish that get tortured. So, with that, I'm going to move back to heart disease, but I'm going to come back to that slide later because that's my favorite one. It enables me to summarize everything in 4 little points. So with heart disease, I'm going to introduce you to my friends, in case you don't know them. Dean Ornish on the left and Caldwell Esselstyn on the right. How many of you know both of those guys? Okay, so I don't need to explain too much about them, but I have met those 2 guys as well and consider them friends. In both cases, these are prominent individuals who have successfully reversed heart disease. They've done scientific studies. They've done controlled scientific studies. And they have proven that heart disease can be reversed in over 90% of the cases. Now, and I just said that. So, and both have influenced Bill Clinton. Wolf Blitzer mentioned both of them on the air in 2010 after Bill Clinton started going vegan, and later they were both interviewed by Wolf Blitzer on the air, and they both talked about it. So they've had all of this great exposure, but yet our medical system still doesn't acknowledge and teach future medical doctors that heart disease need never exist. That's what Esselstyn said. He says, heart disease is a toothless paper tiger that need never exist, and if it does exist, need never progress. So, what I like about the Esselstyn portion of the studies, Dean is more famous than Esselstyn for several reasons. One, he was on the cover of Newsweek in the 90s for trying to help Bill Clinton learn how to eat better. Didn't work back then, but he was on the cover of Newsweek and he got a lot of attention back then. And his studies were not just about food. They were about more lifestyle things, exercise and yoga and meditation and food. In Esselstyn's case, it was diet only. He took 17 patients from the Cleveland Clinic that had basically could not be operated anymore for heart disease. In his home, with his wife, he taught those patients how to eat. And those 17 patients, prior to his intervention, had 49 total cardiac events in 8 years. The intervention that he did consisted only of diet change. No other lifestyle changes. He said, if you're doing exercise, keep doing it, but if you got too many variables, you can't tell which one is really working, right? Now, since then, Dean Ornish's program has been approved for Medicare, but not Esselstyn's. And my theory on that is that Dean Ornish has got 4 or 5 different things going on, and so the government could hide behind the fact, well, it's not all food, it's all these things. If they said it was all food, then they implicate the mighty meat and dairy industries. And I ran that idea by S one day, and I said, so what's the deal on this? And he's a very modest guy that doesn't take shots at anybody, and he said, well, I think you might be on something there. So 11 years after his intervention, he and Ann in their home, not a single cardiac event from those 17 patients. So that's 49-0. That's a pretty good football score. Then you got the Norway data supporting both of these interventions, both of these medical doctors. I don't know if you're familiar with this Norway data, but prior to World War II, this is heart disease, basically deaths from heart disease going up steadily in Norway, just like it was in all of the countries that eat meat, dairy, eggs, and fish. Then the Germans came in, took over all of their livestock, didn't have any livestock for duration of the war, and so guess what? Look at the mortality rates dropped down. As soon as the war was over, 1945, when I was born, boom, it goes right back up, started right back up where it was. So this is a whole country as the laboratory, which I think totally supports the work of these 2 fine doctors. So why doesn't the world hear about these things? It just seems criminal to me that when you got a messenger like Bill Clinton, who everybody can see he's healthy. A lot of people don't like Bill Clinton, a lot of people don't like his wife, but everybody knows his name. But here's what's wrong with our system, our disease care system. People are fed by the food industry, which pays no attention to health, and they are treated by the health industry, which pays no attention to food. Said a different way, and this also applies to cancer and all of the other diseases. I've gone on the websites of all of these, American Heart Association, Cancer Society, diabetes. You can't find anything about a whole food plant-based diet. They'll give it a little lip service and say, oh, you should have a little more plants in your diet, but they never say eliminate animal-based foods. That is not on any of these sites. So here's what Shannon Brownlee said. We have a disease care system. We have a very profitable disease care system. And it's actually, if they really were honest with itself, it doesn't want you to die. It doesn't want you to get well. It just wants you to keep coming back for care of your chronic disease.